Namaste everyone, welcome to CPC Pathshala. I am Prachi Sharma and in today's video we are starting one of the most important section of the CPC exam, the surgery section of the CPT manual. Many students find the surgery section confusing because it contains hundreds of codes. But don't worry, in this series, I will simplify everything for you. Today's goal is not to memorize every code. Instead, we will understand which code range cover which surgical procedure. Once you know this roadmap, finding answer in the CPC exam becomes much easier. So keep your CPT book ready and let's begin. Let's start with fine needle aspiration, commonly called FNA. Fine needle aspiration is a procedure in which a very thin needle is inserted into a lump or lesion to collect cells for examination. Next, common incision and drainage, also known as I&D. This procedure is performed to drain pus, abscesses, cysts, or infected collections. Important points. If only an incision is made but no drainage is performed, modifier 52 for reduced services may be applicable when supported by documentation. Always identify whether the procedure is simple or complicated before selecting the code. Let's talk about the debridement. Debridement means removing dead, damaged, or infected tissue until healthy tissue remains. This topic is extremely important in the CPC exam. Always read the operative notes carefully before the details like depth and size of tissue are commonly tested in CPC question. Let's talk about biopsy. A biopsy means removing tissue for examination. These codes are reported per lesion. Documentation should clearly mention the biopsy technique used. Biopsy technique directly affect code select. Never assume the method. Always verify it in the documentation. This is one of the highest yield topic in the CPC exam. Lesions are divided into two categories: benign lesion and malignant lesions. Here, important point to remember is type of lesion, size including margins, and anatomical location. All three determine the correct code. Repair codes are divided into three categories: simple repair, intermediate repair, complex repair. In exam question, always calculate the total repair length correctly before selecting the CPT code. Adjacent tissue transfer involves moving nearby tissue to close a surgical defect. Important CPC rules. Report the size in square centimeters. The donor side is generally not coded separately because it is included in the primary procedure. Remember this point because it is frequently tested. These codes are used for burn treatment. These codes are generally reported per body area treated. Always review the documentation to determine the correct code. Sometimes lesions are destroyed rather than excised. Coding depends on the number of the lesions treated. Some codes reports a single lesion while others are based on group lesion counts. Carefully count the lesion before selecting the CPT code. Mohs surgery is a specialized technique used mainly for skin cancers. It combines surgical excision with immediate microscopic examination of tissue. Another important rule, the Mohs codes always include both the excision and the pathology examination. These services should not be coded separately. This is one of the favorite CPC exam concepts. The final category in today's overview is breast procedures. One important CPC guideline: if imaging guidance is used, it is generally reported separately whenever applicable. Always review the operative documentation carefully before selecting codes. That's it for today's surgery section overview. If you found this video helpful, don't forget to like, share and subscribe to CPC Pathshala. Also press the bell icon so you never miss our upcoming CPC coding lessons. If you have any questions, leave them in the comment below and I will answer them. Thank you for watching and I will see you in the next class. Happy coding!